My name is Dr. Ahmet Atalik. I'm a medical aesthetic practitioner in Istanbul. I started my aesthetic journey very early and I completed a lot of courses and studies. I have performed cosmetic and aesthetic procedures in the face and body for over a decade. I have given several presentations related to complication management of aesthetic applications and botulinum toxin A fillers and threads. I regularly lecture and train aesthetic medical practitioners in advanced aesthetic medical treatments and techniques in Turkey and abroad. As an expert, I was the faculty of the first face cadaver workshop in Turkey. I am a member of American Aesthetic Academy Association and international trainer of First Surgery Concept, Professional Derma, and ISAM. There are few permanent lifting threads in the aesthetic market. Also, there are different techniques for facelift and straight laying technique. One of them is simple and safe for the beginner level. Vectors of the face are well known for doctors, and straight laying shows how we can use these vectors easily and safe. When doctors cannot compare all these techniques during the beginner level, and straight laying technique can help them. Straight laying technique for facelift with permanent threads is a simple, safe, and effective way to applying with permanent threads. If initial planning is done properly, there is no surprise in results should be expected. Hello, I'm Dr. Ahmet Atalik. I'm a medical aesthetic practitioner in Istanbul. Today I will present you a full face thread lifting and neck tightening also. I will start with patient evaluation. Which areas? My experience areas are nasolabial fold, marionette lines, and sagging cheeks, and neck tightening. The first 3 points on the temporal region area for entry holes. Our aim is to raise and open and correct the nasolabial fold and marionette lines, as you see on the screen, and sagging cheek area between the pregious sulcus and master muscle area. Our aim is to correct these 3 parts raise. The main advantages of this medical thread lifting using skin tightening threads as a rejuvenation technique as follows. This technique, this product also suitable for both man and woman, and for patients from 35 years to the over 70s. No scars, as no surgery is required. Now, the second area is the neck and double chin. The first point for double chin and second point entry points for neck tightening. This is our exit points. This is our entry point and exit points, both sides. And after the planning of the thread lifting, we are starting with local anesthesia. I will use lidocaine. You will see this is my entry points on the temporal region. This is for nasolabial fold, marionette lines, and sagging cheek area. And this is the exit points for the hair area and the second disinfection part. And my entry points, I'm opening holes, 3 holes, and I'm using 70 millimeters and 19 gauges cannula for tunnel anesthesia, upside and downside, both sides. Skins, I'm also using this subcision, you can see. My material is 30 centimeters and two sides. There's a midpoint. There's a 20% elasticity. And I start the implantation of the, yes, you can see. Why I choose this material? This is biocompatible composite material made of a polyester core on which is molded a medical grade silicone, and as I mentioned before, there is a elasticity 20%, provide a spring effect which compensates the creep of classic threads and gives a dynamic effect which continues to act after implantation. And flexibility, I can pass easily and facilitates installation and avoids any risk of extrusion of the wire. The face and neck type is 0.5 millimeters diameter and really high density of spikes and measure wire length up to 30 centimeters. Yeah, this is the third thread for second cheek area. And more security, less complications. Medical grade polyester and silicone used are perfectly as a biocompatible materials. Medical silicone implemented for over 50 years. They are stable and inert. And more duration and economical for patients. Highly resistant. It's a thread composed of flexible and elastic spikes. And it lengthens and follows muscle movements without risk of breaking. This is our second part, the same procedure for 70 millimeters cannula for tunnel anesthesia. Another issue is CE marking, and this material also class 2B and compliance with ISO 13485 standards attests the rigor brought its manufacturing. What are the main advantages of thread lifting? It's a time-saving procedure, really minimally invasive treatment, and short recovery period. A 2% anesthesia is enough, and long-lasting effects. I want to put one more. Which areas are more experienced areas? Nasolabial fold, minute lines, sagging cheek, eyebrow ptosis and lateral part, and sagging neck and tightening neck. And results are and effects are natural and alive because flexibility of the skin and tissue is observed. And the threads are colorless and their implementation is done simply and quickly without leaving any scar. And sagging of the cheekbones and cheeks and removal of the nasolabial folds, removal of the bitterness fold, raising the tail, lateral part of the eyebrow, and correction of the oval of the face, and treatment of sagging and folds in the neck. The optimal results is achieved approximately 2 months after the thread implant procedure, The first week, edema and traction lines, a little dimple, application should be seen. Third and last thread for face, for sagging cheek area. Tissues are effectively supported and result achieved is exponentially natural. The face after implementation remains very animated with a reshaped oval and revitalized deep contours and more defined look around the eyes. And this is our second area is neck. The first entry point is to reduce the double chin area and second for neck tightening. Both threads, these two threads, will be tightened to the neck. And the same procedure, 70 millimeters cannula for tunnel anesthesia. Avoid of the go to the plasmal bands. Our plane is subcutaneous layer, and our aim is to catch to the sternocleidomastoid muscle fascia and both sides. Midline is our entry points, and both sides I'm going to laterally, and the second point for this is going to the subcutaneous layer. I'm controlling with my other fingers, and this is the one side of the for neck tightening threads. And this thread contains a larger number of barbs than other threads, providing a strong anchorage. And my material, this implementation is non-resorbable, and result lasts 2 or 3 times longer than the other absorbable threads. Elasticity is important because they follow your facial mimic movements. I don't want any dimple, and my entry points will be released by the cannula. You can see the all sagging fat pads are going up. It means reposition of the sagging fat pads, nasal fold, marionettes, and jaw, and tightening. The first we are starting with the upper side. There is application now, as you've seen, after the opening and tightening, application is disappeared. This procedure is suitable for both men and women, and ages 35 to over 70s. No scars, as no surgery is required. No general anesthetic and no hospital stays required. Very natural results. No change in facial expressions, and safe for also smokers. The result of tissue lifting is immediate and does not alter facial features. The result improves over time. After 2 months, which is time then required for fibrosis to develop, because the first 2 months, our expectation is pubic bands fibrosis will develop. In addition to this result, which occurs after 3 to 4 months, it's also interesting to note how the skin then slackens much more slowly because hypodermic support is long-lasting. This is very apparent after 5 years. And control, and now you can tighten off the neck. You can see double chin disappeared, and you can see how the tighten off it. There is no dimple, there is no traction lines. Now you can see the correction of double chin and tighten of the neck. And both sides control, bleeding control. Check. You can see there are 2 traction lines. These lines will be disappeared approximately within 1 week. And this side also has a little edema. And last controls. This is the final part, and I can start to cut the threads. Two barbs are outside and I'm cut. And nasolabial falls, I'm cutting to the C. Bleeding control also, and cheek, and double chin and neck. The left side of the patient, you can see. And now you can see how the correction of the nasolabial fold, marionette, and the jawline. You can see the singing areas and this part. And you cannot see the double chin and neck tightening both sides. This is before pictures, and this is the after, and thank you for your attention.